Hello, my name is Katherine Salinas, and this is my DNP presentation on effective peripheral intravenous catheter insertion method on pain and satisfaction. A hospital in the Midwest region of the United States experienced a significant issue establishing peripheral intravenous access. Pre-existing conditions and/or new diagnoses contributed to difficulty establishing peripheral intravenous access in adult patients. The chosen facility did not employ a vascular access team at night, and as a result, patients were at risk for adverse effects, including not receiving life-saving medications, requiring multiple needle sticks, and or having invasive central venous catheters placed. To address this issue, a quality improvement project was launched to implement ultrasound-guided intravenous catheter insertions. In adult patients with limited and/or difficult venous access, does the use of ultrasound-guided peripheral intravenous catheter insertion, as compared to standard palpation intravenous catheter insertion, decrease pain scores and improve patient satisfaction? This was the research question guiding this project. And the aim was to determine the least painful and most satisfactory method of peripheral intravenous catheter insertion. Literature review established three themes, and the highlights were that higher levels of satisfaction were reported with ultrasound-guided peripheral intravenous catheter insertion versus traditional palpation intravenous catheter insertion methods. Efficacy rates were also higher with the ultrasound-guided peripheral intravenous catheter method. And the last theme was that decreased pain scores were found with the ultrasound-guided peripheral intravenous catheter insertion method. The theoretical framework for this quality improvement project was Gene Watson's theory of caring. The theory of caring says that caring is the foundation of nursing practice. Theory of caring focuses on practitioners caring for their patients, as practitioners and patients are all part of the same caring cosmos. Caring affects health, education, and human service practitioners. Watson believed that nurses specifically have a disciplinary focus on caring and how it affects health and healing, which is what differentiates nurses from other medical or health care specialties. Since caring is so deeply rooted in the essence of nursing, it's also important for nurses to maintain and grow their abilities to care, connect, and heal. One aspect of quality patient care that leads to best patient outcomes is patient satisfaction. The aim to increase patient satisfaction and decrease pain exemplifies the desire to provide compassionate care, connect with patients, and provide healing interventions. Competent application of the theory of caring can improve patients' perception of care and overall satisfaction. Because patients' needs in intensive care units can be highly sensitive and vitally important, nurses are required to not only provide care timely, but also with a high level of caring. The patients in this study were patients in intensive care units. Therefore, applying the theory of caring assisted in finding the method of intravenous catheter insertion that was most caring for patients while enhancing the level of caring for patients. The methodology for this scholarly project was that it was connected at a hospital in the Midwest region of the United States. The sample included patients requiring peripheral intravenous access who met inclusion criteria for either standard palpation intravenous insertion or ultrasound-guided intravenous insertion. The focus of the study was comparing these patients' pain scores and satisfaction levels for each insertion method. Prior to this quality improvement project, there was no assessment of patients' pain or satisfaction following intravenous catheter insertion. So, in order to determine the least painful and most satisfactory method of intravenous catheter insertion, quality improvement project was implemented at the hospital by the researcher in collaboration with the critical care director, clinical team managers, and nurses. And the following strategies were implemented. Patients who required a peripheral intravenous catheter received intravenous catheter placement via the standard palpation or ultrasound guided insertion method based on inclusion and exclusion criteria. After which time, following successful intravenous catheter insertion, patients were then surveyed questions from the data collection sheet. A quantitative exploratory design was utilized through a prospective survey for this project. The researcher reviewed each patient requiring a peripheral intravenous catheter to determine if the inclusion criteria was met for either standard palpation or ultrasound-guided intravenous catheter insertion method. Once patient inclusion criteria were met and successful placement of a peripheral intravenous catheter using the appropriate method had been achieved, patients were then approached to obtain oral consent for participation. All patient identifiers were removed. Each patient was then assigned a number on the data collection sheet. The author recorded the minimum necessary data to accomplish the goals of the project on the data collection sheet. No patient identifiers were included in the data collection process. It was anticipated that 106 patients would meet the inclusion criteria, and therefore the data collection process was stopped when the researcher satisfied the requirement of 106 patients that met the inclusion criteria. Inclusion criteria for standard palpation intravenous catheter insertion were as follows. Participants must be 18 to 89 years of age, be a patient at the selected hospital while the researcher is on duty within the dates of June 1st, 2022 through July 31st, 2022, be capable of providing oral consent, require an intravenous catheter, and have palpable and or visible veins in at least one arm when a tourniquet is applied. The inclusion criteria for ultrasound-guided intravenous catheter insertion were as follows. Participants must be 18 to 89 years of age, be a patient at the selected hospital while the researcher was on duty within the dates of June 1st, 2022 through July 31st, 2022, be capable of providing oral consent, require an intravenous catheter, not have palpable and or visible veins when a tourniquet is applied, have a history of requiring ultrasound-guided intravenous catheter insertion, and or have at least one unsuccessful standard palpation peripheral intravenous catheter insertion attempt. Also have one or more unobstructed veins visible in at least one arm with ultrasonography that were less than 3 centimeters deep. The exclusion criteria for the standard palpation intravenous catheter insertion were as follows. Participants may not be less than 18 years of age, be 90 years of age or older, be mentally disabled, disoriented, confused, and or have altered mental status. The exclusion criteria for ultrasound-guided intravenous catheter insertion were as follows. Participants may not be less than 18 years of age, be 90 years of age or older, be mentally disabled, disoriented, confused, and or have altered mental status, have veins that are palpable and are visible in at least one arm when a tourniquet was applied and no standard palpation peripheral intravenous catheter insertion attempts, have no visible veins in either arm with ultrasonography, have no veins visible in either arm with ultrasonography that are not obstructed, or have no unobstructed veins visible in either arm with ultrasonography that are less than 3 centimeters deep. The steps for the project were as follows. Step 1, after IRB approval was obtained from Maryville University, the data collection process began with the researcher being notified of the patients at the selected hospital who required intravenous catheterization while the researcher was on duty from June 1st, 2022 through July 31st, 2022. Step 2, participants were engaged. This project was performed as a prospective study. Step 3, the researcher reviewed each patient to determine if inclusion criteria was met for either standard palpation or ultrasound-guided intravenous catheter insertion. Step 4, each patient included in the project was given a numerical value. The patient was assigned a number on the data collection sheet. Step 5, minimum necessary data was collected on the data collection sheet to achieve the goals of the project. No patient identifiers were included in the data collection process. The data collection process stopped when the researchers satisfied the requirement of 106 patients that met the inclusion criteria. Data collection instruments. All patient identifiers were removed from the data collection process. Patients were assigned a number on the data collection sheet. Data collection sheet identified which method of intravenous insertion the participant had. Participants' pain scores were rated on a 10-point numerical scale and recorded, and participants' level of satisfaction were recorded on a 5-point Likert scale. The analysis plan was that this project used a quantitative exploratory design. The level of measure was independent ordinal data, which was analyzed using SPSS statistics software. A Mann-Whitney U-test was utilized. Mann-Whitney U-test is useful in comparing differences between two independent groups when the dependent variable is either ordinal or continuous, but not normally distributed. In the case of this project, the independent variables were the intravenous catheter insertion groups, i.e. the standard palpation versus the ultrasound guided. Dependent variables were pain scores measured on a 10-point numeric pain scale and satisfaction levels measured on a 5-point Likert scale. The desired sample size was 106, which resulted in an effect of 0.5, a level of significance of 0.05, and a power of 0.8. The project lasted approximately 2 months. It was anticipated that there would be 106 participants, and the total approximate cost for this project, as demonstrated in this table, was approximately $3,281.73. The timeline for this project was 18 months. Following IRB approval, the next phase of the project was data collection in the selected hospital. The data collection process took approximately 2 months from June 1st, 2022 through July 31st, 2022. Analysis occurred after the data collection period. Final report was completed by November 2022. The final project report included the completion of the 5 chapters. And you can see the breakdown of when the chapters were completed in this graph below of the timeline. Protection of human subjects. The hospital's location was only described as a hospital in the Midwest region of the United States. All patient identifiers were removed and not included in the data collection. Data collection sheet was a Word document stored on a password-protected computer kept in the author's locked office that could only be accessed by the author. Each participant was assigned a number on the data collection sheet. Data was shared as part of the DMP Scholarly Project. Project was shared with the researchers, faculty advisor, and Maryville University community members, and may be shared as a poster session for a medical conference or submitted for publication in a reputable journal in the future. Project may also be shared with healthcare providers and hospital administration at the selected hospital. All information was presented without identifiers in an aggregate form. Research data will be destroyed 3 years after completion of the project. Validity is the extent to which an instrument measures what it's intended to measure accurately. Content validity is the degree to which instruments appropriately measure the desired content. Content validity was achieved in this study by performing extensive subject matter research to develop the instruments to be used. Reliability is the extent to which an instrument will consistently yield the same results. In order to ensure reliability, the researcher alone inserted the peripheral intravenous catheters to eliminate interference of experience or training methods or deviation from the study's methodology. To ensure data quality and adequacy, the researcher was also the only person to obtain oral consent, conduct the post-insertion survey of pain scores and satisfaction levels, as well as record the values given. Data for this project was analyzed using SPSS statistical software and with the help of Dr. Pals, the statistician at Maryville University. There were no adverse events, missing data, or additional exclusions that affected data values. This project was a quantitative exploratory design using a post-peripheral intravenous catheter insertion survey to compare pain scores and satisfaction levels of standard palpation and ultrasound-guided methods of peripheral intravenous catheter insertion. Time frame was sufficient to include the desired number of participants in order to collect statistically significant data. The limit of the time frame prevented burnout of the researcher inserting the intravenous catheters while on regular duty shifts at the facility so as to ensure quality intravenous catheter insertion. Limiting the intravenous catheter insertions to only the researcher also ensured consistent training and execution of insertion techniques. Data analysis showed with statistical significance that pain scores were lower and satisfaction levels were higher with the ultrasound-guided method of peripheral intravenous catheter insertion compared to the standard palpation method. The average pain score for the ultrasound-guided method was 3.32, while the average pain score for the standard palpation method was 8. The average satisfaction level for the ultrasound-guided method was 4.38, while the average satisfaction level for the standard palpation method was 3.21. The trends of pain scores for standard palpation versus ultrasound-guided methods of intravenous catheter insertion were comparable with each category. The overall pain scores for the ultrasound-guided insertion method were lower than those of the standard palpation method, as evidenced by this graph. The overall satisfaction levels were higher with the ultrasound-guided insertion method than those with the standard palpation method, as you can see by this graph here. And as evidenced by this bar graph, the mean pain and satisfaction scores showed similar comparison. A Mann-Whitney U-test was utilized to analyze the data. A sample size of 106 was needed to have an effect size of 0.5, level of significance of 0.05, and power of 0.8. The sample size of this study met the minimum of 106 participants. The achieved power for both pain scores and satisfaction scores was 1. This indicated a strong power for both measurements. The significance for both pain and satisfaction scores came back less than 0.001. This indicated a significant difference between the standard palpation and ultrasound-guided methods of insertion for both pain and satisfaction scores. Sufficient information was achieved to conclude a difference between the insertion methods in relation to pain and satisfaction scores. Facilitators and barriers: there were no unexpected failures, problems, or associated costs. There were no changes that were necessary to the implementation of the project. No data was identified as missing. Potential association with different training experience and technique of the intravenous catheter insertion was minimized by using the same person, the researcher, to insert all of the IVs throughout the project. The hospital's patient census and general need for intravenous catheter insertion was normal for this time of year and therefore not a barrier for the project. Participation in the study was limited to when the researcher was on duty. However, since the target number of participants was achieved, this did not seem to be an inhibitory factor. The intensive care department director was supportive of the project, and managers and staff nurses helped facilitate identification of participants by notifying the researcher of patients in need of peripheral intravenous catheterization. Strength of this study included the evaluation of both pain scores and satisfaction levels. Combining both measurements into one study allowed for additional comparison and data collection. Another strength was the continuity of intravenous catheter insertion, as the researchers solely placed all of the intravenous catheters. This kept training experience and technique related to insertion consistent, thus minimizing potential results differentiation based on those factors. The target amount of 106 participants was reached as well, making the large sample size an additional strength. Generalizability is the amount to which research findings from a sample population can be applied to a larger population. This study has good generalizability. The sample size was large at 106. It was statistically significant and comprised of typical patient demand for intravenous catheters for that time of year. Therefore, it can be inferred that the results of this study can be easily generalized to apply to larger patient populations. Since the results are generalizable and methodology has high replicability, the results of this study can be easily sustained. One of the limitations to this study was that participation was limited to when the researcher was on duty, as the researcher was solely responsible for all the intravenous catheter insertions. Despite this limitation, the target number of participants was still achieved easily. It was ultimately decided not to attempt to mitigate this limitation, as keeping the researcher as the sole inserter helped minimize potential result errors caused by differences in training, experience, and insertion technique. And since the target number of participants was still achieved, this limitation did not seem to be an overall inhibitory factor to the study and is arguably a benefit to the overall results. One of the predicted outcomes of this study was that participants would report lower pain scores with the ultrasound-guided method and higher comparative pain scores reported for the standard palpation method. Another predicted outcome was that participants would report higher satisfaction scores with the ultrasound-guided method compared to lower satisfaction scores with the standard palpation method. The observed outcomes were that patients reported comparatively lower pain scores and higher satisfaction scores with the ultrasound-guided method. The observed outcomes therefore aligned it with the expected outcomes. Because the compatibility of the observed and expected outcomes data has been shown to be very strong. While this project had a large sample size, an even larger sample size would make the data even stronger. This could be achieved by extending the time frame of the project and/or incorporating a training program to have more people insert peripheral intravenous catheters without compromising the consistency of insertion technique. The results of this project implied that ultrasound-guided method of insertion was less painful and more satisfactory. Implications to practice could include more successful, less painful, and more satisfactory intravenous catheter insertion for patients. Better catheter insertion experience can lead to improved patient compliance and willingness to receive intravenous catheters. Furthermore, having a more reliable form of peripheral intravenous catheter insertion can lead to faster medication, fluid, and blood administration, better pain control, and overall improved quality of patient care. Having more reliable intravenous catheter insertion improves patient safety as it has the potential to reduce the number of insertion attempts, which keeps the skin more intact and decreases infection risk. Further research could incorporate this data into comparing success rates on insertion methods, number of insertion attempts, patient demographics such as medical history, intravenous drug use, and other factors that affect intravenous access. Based on this data, healthcare policy could be changed to incorporate more standards to increase the use of ultrasound-guided insertion method. Inclusion and exclusion criteria from this study could be used to standardize policy for determining which patients are appropriate for ultrasound-guided method. The results of this project showed the expected outcomes that the ultrasound-guided method of peripheral intravenous catheter insertion is less painful and more satisfactory for patients. It is therefore recommended that more nurses, especially nurses in high acuity areas such as intensive care units, be trained to utilize the ultrasound-guided method of peripheral intravenous catheter insertion. It's also recommended to establish designated vascular access teams for day and night shifts in order to improve availability of ultrasound-guided insertion. Having more nurses trained and increased availability will increase patient access to this method of insertion, which can lead to improved quality and safety of patient care. While the data from this project is strong, there are still many opportunities for building on this study with future research. These are some of the references used for this study. These are additional references. And thank you for your time.